Good afternoon, everybody. I'm going to talk about digital marketing. Okay, you have all this software, you all put it up, everything. But today's digital age, like when Dr. Rangraj was talking, I just got a message on WhatsApp from my friend. He had asked me where I was, and I said I'm in Delhi, and he sent me a few pictures, couple of OCTs and couple of fundus pictures. I just replied saying this patient has got paravoltaic ataxia, nothing to be done. Take care of him, and that's it. So that's how this world has changed. A couple of years back, he would have called me and then I'd have said, no, I'm not available, send him next week, and then I'd have done all the investigation and all. So this is how the world has changed. So we have to change. Change is the only constant, and not only implementation in your hospital, you will have to market yourself, your services, and that also needs EMR and digital marketing. So we will see how we go about it with an introduction, how it is relevant, and what all ways we can do it. As I told you, the world is really interconnected. It's a very, very small world these days, and you can literally reach anybody, anywhere with WhatsApp and Facebook and all those things these days. So you have to use it to reach your target audience. Yes, you have WhatsApp, you have Facebook, you have everything, but it is not just fun. You can use it for productivity. You can use it to progress and push your practice and your healthcare system also. So there is a tremendous scope for digital marketing activities, and we have to identify even more new opportunities by going even more digital. And we have to target both the audience to which we have to cater and also what we need to do. And we have to bring more and more of our services online. And you know, it is very easy to access information these days. Every other patient, once you give them a diagnosis and a treatment, they go online and then come back to you after a couple of days with saying, this is what I find on the net. But the problem with the internet is, you get all sorts of information. So it is better you put more credible, more reliable information on the internet yourself, rather than he going and doing a Google search and finding something and coming up with 2 or 3 different hits, and then you have to pull your hair out literally in the OPD. And it's not just a unichannel distribution. There are multiple ways and paths through which you can do it. You can do it through internet, you can do it through web, through social media, and last but not least, most important, through your mobile phone. Okay, so we know internet is already there. It is there to stay, and it is booming even more, and we are going to reach tremendous numbers over the next couple of years. And as I told you, it has become the source of truth. They used to get information they use information from the internet for literally everything. And what we need to do, first thing, we need to give details of the services we provide. So anybody wanting to come to your hospital, goes to your website, you need to say that, okay, I do this. He should know what he is in for. He should know what he can expect. Second thing, your capability, the doctor's capability. If you go to a decent hospital's website, you will see all specialties, a multi-specialty hospital, all specialties listed, or even often you will see retina, uvea, etc. And you will have his short CV or short resume there, which the patient can see and then get impressed. And you should also have some sort of information on the common health conditions which the patient can come to you with, like, for example, cataract, which all of us, few years back, we used to have all pamphlets in our table, and we used to give a pamphlet to each patient, which most of us still do. But the patient should know this even before he sets foot in your premises. And even after that, he should be able to track whatever he is undergoing or going to undergo through the internet. That is the next step. And you know that the digital content, as I told you, has become very important in decision making on the patient's part. And even if you advise a surgery, you tell him this is how it is. 2 days later, he comes and tells you, yes, sir, I saw that surgery on YouTube. So it is not that you're going to do something which he doesn't know about. And digital marketing, EMR is going to be, there's going to be initial cost, but compared to traditional marketing, the cost of digital marketing is much lesser, and you can focus on a much better target set of patients, and patients get more loyal. And most important, compared to other media of marketing, digital marketing, your communication can be bi-directional. If you're going to put an ad on a paper, or you're going to put it on a radio, or etc., the patient is going to hear it, and that's it, end of story. If it's on the internet, he can respond, you can reply back, so it's a bi-directional communication, and you can extend your reach of your brand also. And as I told you in the previous slide also, he can give you reviews, feedbacks, you have positive reviews, etc. So you can use digital marketing as an advertising medium. You can use it as a direct response. It's an e-commerce platform. End of the day, yes, we can talk about our noble profession, but yes, we are doing commerce, and that's it. There's no two thoughts about it. And it's a very good distribution channel as well. And what are the channels we can use? The most common thing is you have your own hospital website. You can have a hospital website with a patient portal. You can give all the information there, and you can literally extend your relationship, and you can give all your products. You can tell what all lenses are available and what they would do, how a monofocal works, how a multifocal works, who's best suited for a multifocal, etc. And social network. How many people own individual hospitals here? How many of you all have your own Facebook page? Hospital's Facebook page. So that's less than half. So that shows it. So we all have our own Facebook accounts, but our institutions don't have their Facebook accounts. So it is more important that our institutions have Facebook accounts, and even on Google Plus, etc. And you can also go through mobiles. Now we know a lot of hospitals, the moment a patient gets an appointment, you send him an SMS, or even a doctor refers a patient to you. The moment the patient sets foot in your hospital, he gets an SMS saying, thanks for referring so-and-so, and he's been received and he's been taken care of. And when you dispose the patient, you can have another SMS saying, this patient has been taken care of and he's been advised this. So that's how it works. And email. Email doesn't cost anything. No paper. It's more friendly to the environment. You can do mass mailers, etc. And advertisements. Yes. You can advertise on the internet. You can sign up with different search engines. Yes, you may say that, well, if you type my name on Google, I get all my responses. Invariably, you'll get all your publications coming up on Google, but your patient is not going to be guided by that. So you can have sponsored links coming up on every search engine, and you can also have it go on to social web networking sites, where a patient who goes and he starts discussing about something, the next time the cookie says, okay, and your ad pops up there. And you can also display promotions with a small link to your website, and as I said, bulk email, etc. And you can create a responsive website. You can create a website which works on multiple devices, like a computer, a mobile phone, or whatnot. And you can also optimize search engines. Like I was working abroad, and my consultant was a refractive surgeon. My clinical head was a refractive surgeon. So he had a Google keyword saying that I was working in Essex, United Kingdom. So he said laser, eye, and Essex. If these three words come in any combination, his hospital's sponsored ad was the first thing coming online. So he said, I'm targeting to this population. Anybody searching for any laser in the eye, this is my hospital's website will come up first. So that's how you optimize your search. It's not going, somebody is looking for something else is not going to come to you. And you can give your medical information to the patient. And appointment management. We all know people call up or whatnot and fix up appointments, but everybody's got a mobile phone and everybody's got internet on the mobile phones. It makes my life much easier. Even if you want to book a train ticket, you don't really go and sit on a computer today. Train ticket, flight ticket, you just do it from your mobile. Same way, we should be enabled so that you can make your medical appointments also from sitting wherever you are on your mobile. And as I said, social platform, it creates more visibility, it attracts more visitors, and as I said, you can do a lot of social networking. And my last slide, mobiles. So all this is okay, but we have to bring it to use in a mobile phone. So as I said, you have to make sure you can book an appointment, you can track whatever is having, or he sends an investigation, gives blood for investigation, goes back home. He should know when he's going to get the reports, and if he needs any other extra medical information like a medical record, etc., he should be able to request online from his mobile phone and get it. And as I said, it should be available across multiple platforms like iOS and Android. And we also would be able to communicate to our patients through SMS. Thank you.